connecting to the cloud, it says. So it should be recording. Yep.
Yeah, it says you're recording.
Yeah, am I recording? Yeah, yep. Good. Okay, thank you. Yeah, thanks for reminding me. I forgot that already. See, so yeah, so now it's on the cloud, wherever that is. You know, like
it's everywhere then.
Yeah, I never know where that cloud is, but anyway. So anyway, the back of the packets have all of the information that I would show you on the overhead and things that we're going to talk about in a discussion. There's a legal case in here of Norton versus Argonaut Insurance Company. And we'll look at that, and we'll talk about prescriptive authority for nurse practitioners, ways to cut med errors. There's also an orientation to pharmacology, some questions. Those questions are just for you to practice with. They're just practice questions, and I'll give you the answers. We'll talk about them and hopefully have some answers there. So each packet will have stuff like that in it, so you have a sense of what is in each one, so that hopefully that will help you. And I'll try to give them to you ahead of time so you have them. Do you have any questions about those packets or anything, or hopefully that will help you? And like I say, I'll post the plain PowerPoints out for you. And then I will also put some narration ones out there and try to figure out how to make it better for you.
How are quizzes working for class? Are we going to be taking them every week?
Yes, right at the moment. Now again, you know, the quizzes are scheduled to be every week. The quizzes in pharmacology are different than all the other nursing courses in that the quiz is given after the lecture content. So next week, my plan is to have a quiz for next Friday morning, is to have a quiz on legal aspects. So whatever we cover today will be quizzed next Friday to do that.
Is there a particular time? Only because we have lecture after this.
Yes, we'll do the quiz first, and then we'll have lecture after. So it's done right at the very beginning. Get it out of the way for you, so that you're not sitting through class going, oh, I wonder what kind of questions she's going to ask. The quizzes in pharmacology, I'll share with you, are mostly fill in the blank at this point. They're written quizzes. I don't do very many multiple choice quizzes in pharm because I like you to think and put out things that I you know, to write and sort of organize your thoughts and put things together. So, but they're given after the lecture. So you will never have a quiz on new content that we haven't covered or talked about.
Is it like a word bank or like a legit fill in the blank?
It's a legit fill in the blank. It's just, yeah, it's not a word bank. Oh yeah. You know, I don't spell that well. So, you know, like I like trouble with that. No, it's just like, you know, tell me your thoughts on whatever. And you can just, so there's no word bank. I'll grade them all by hand. So, which might take me a while, but I will do that. So that gives you an opportunity. The word bank stuff is very difficult to manage. And if you don't say the exact right word or you spell it incorrectly, it doesn't give you a grade. So I will I will do that. So
you're going to ask us the questions at the beginning, like, and we write them down on paper?
No, I'll send the quiz, and you'll have the quiz in front of you, and then you can fill it in and hopefully email it back to me. That's my plan.
That's through Respondus?
Yes, and I'm hoping that will work. I haven't quite figured that all out yet, but I will by next Friday or the Friday. I'm not sure, but anyway, we'll work at that. Yeah.
Our test questions.
The PowerPoint that you made, like the questions, can we rely on the PowerPoint to study? Or is there stuff in the text that is not in the PowerPoint that will also be covered?
There's some in the text, but I would say a majority of it is stuff that I will say in class, okay, or covered on the PowerPoint, or covered in some of the handouts material that I give you. So that that textbook, while it's lovely, it's very, very complicated. And a lot of the stuff in it is not stuff that a nurse needs to know at the ADN level. If you were in a master's program, maybe, or, you know, where you were prescribing and doing that. So I try to pick out what I think are the most important parts of the content that you need to know from an ADN perspective and share those with you.
I think it makes it a lot less stressful, like
Yeah.
the PowerPoints. And usually in most nursing classes that we've done, most of the questions come from the notes. So
Yep.
it cuts down on
Yeah.
stress and time that we spend reading the whole text. And
Yep. Yeah.
Okay.
And you can, like my thing would be you could skim over those chapters I give you, kind of, highlight or whatever. But for the most part, I try to give you all of the information because it's hard. The stuff is, and that textbook is really complicated. And we're going to change textbooks, but that's not for you guys because you don't want to have to buy another text at this point. So we'll just do it that way if that works. Okay.
And how
Can I
big
just
are
say
your
something real quick?
quizzes?
Pardon me? Go ahead. Kathy, I got you on.
How big are the quizzes? 10 questions?
10 questions. Yes, they're 10 questions. All the quizzes are 10 questions. Mm-hmm. Yep. Anybody else? Yes, go ahead.
This book I got on Amazon, maybe
Yep.
$30 or so.
Uh-huh.
It
Very good.
simplifies, like, yeah, it's still got
Yeah.
the information, and it like has little pictures and notes, and
Uh-huh.
it still touches the points that are in the big book.
Yep. So yeah, I was gonna say, don't hesitate to buy if you find something like Farm Made Easy. I got another one. I don't know where it is at the moment, but the textbook that we're going to use is sort of is I think it's by Lilly, and that has the same kind of content and so forth. So so if you can just skim Lenny, and then right now rely on the PowerPoints and my notes and my class comments, I think you'll be fine for what we're going to do.
I
Okay.
have a quick question.
Sure.
So are you going to plan on giving us hard copies of these PowerPoints every week?
Yes.
So will we be getting them in lab like we did?
Yes.
Okay.
I will post them. I will post the actual PowerPoints on Blackboard ahead of time. I'm going to post them all this afternoon, actually. I'll post all of my PowerPoints. Then I also print them because people sometimes like printed versions of PowerPoints to make notes on. And I discovered in the spring that a lot of students don't have printer access, or it's just so much paper that you can't. So I'll print them at the college, and they will give them to you in lab ahead of time, way ahead of time. So you have the PowerPoints printed as well as what's on Blackboard, so you can look at them. I try to, give you everything I can think of to give. Anything else? Any questions as I go on, or is everybody okay?
Is the
So,
exam fill
yeah.
in the blank too, or is it like multiple choice?
The exams, the first 45 questions are multiple choice, and the last 5 are fill in the blank. They're they're alternative format questions for all the exams.
Okay, thanks.
Okay. I'm going to try to go out, and like I say, I'm not a technology person exactly. So I'm going to try to go out to share screen and look at the departmental guideline. And hopefully you can see that okay or not. Yes, no?
Yes.
Yes. Oh, good. Okay. I know, it's like I never know for sure kind of thing. But if you look at, and I posted this, but just to kind of go over it, this is a 3 credit hour course, and it's 3 hours of lecture, and everybody has the prereqs, obviously, so I don't worry too much about that. You can see the core student learning outcomes of what they are: major categories, classification, individual drugs, how drugs interact with body systems, legal aspects of pharmacology, nurses' responsibility and administration, observation, documentation, and the rationale to a particular diagnosis. Class attendance is required and so forth. Lecture discussion, audio, visual, computer programs. That's pretty much ATI is what all of that is. Case studies, and there's a research paper, and we'll talk a little bit about that. This is the evaluation part of this. 20% of your grade are the quizzes. And in the past, and this is part of the outline, our policy, is I think there are 12 quizzes, and I dropped the 2 lowest grades. It's how that works. So, so it gives you an opportunity to have a bad day. There are 3 exams, and they are 30% of your grade. The research paper is 10% of your grade. The final comprehensive exam is 30%, and integrated assessment is 10%, and that is your ATI. And I'll tell you a little bit more about that as we go. Does Katie talk to you at all about ATI?
Yes.
Yeah, okay, so you kind of know. Now, this is the outline of all the things we're going to talk about in the farm. It is introduction, history, legal aspects, drug action, respiratory, cardiac, vascular, renal, GI, neuro, psych, endocrine, and inflammation, and for antibiotics. So those are the topics of the categories that we'll do. The textbook, you've got Lenny for a textbook, and please feel free to use any other resources that you can find out there that work for you. That's fine with me. Now, I don't have an office on campus at the moment, so my office is remote. It's in my dining room. A phone number. Let me give you I didn't post it on here, but let me give you my telephone number if you need to call me. I have a cell phone, and the number is 315-783-9931. And that's my cell phone. I have very poor cell service here. So don't be surprised if it goes to voicemail, because a lot of times when people call me, if I don't have bars, which I don't a lot, if I'm not outside, it doesn't ring. And so it goes right directly to voicemail. Just leave me a voicemail and I will get right back to you. So
Can you repeat your number, please?
sure. 315-783-9931.
Thank you.
Okay. One of the things I wanted to talk to you is about office hours. I didn't know if you wanted me to have office hours, if you like office hours. I'm glad to set up a Zoom thing and you can click in if you have questions, because I'm not on campus and I won't be. And I didn't know if there was something, if that's helpful for you, or if you just want to email me and I get back to you, or I can post things on Blackboard. If somebody has a question, I can post it on Blackboard. I wasn't sure what would be the best for you.
I would probably just email you and request a meeting if I came up with something.
Okay. And I'm glad to do that. If like I say, we can do that. Like I say, I have a Zoom account, so I'm glad to set it up on Zoom or however, kind of thing would work. Well, if you get to a point where you would like to have a meeting or something, just let me know and we can set it up.
Can we use like the discussion board in the Blackboard for our own conversations?
Sure, absolutely. Go ahead.
Want you to like chime in there too? You
Yep,
can.
Yep, you can. The thing with Blackboard is I'm not on it every day, so sometimes I miss stuff. But if you send me an email and say, check out Blackboard or something, I'll get on it and do it. So yeah, like I say, it's kind of trial and error for me, doing all this stuff remotely. And this is a very large class. We've never taught this we've never taught this course remotely. So, we'll kind of do the best I can. But anyway, that's where we are with that. So.
Dr. Hess?
Yes.
You mentioned that there's going to be 12 quizzes and we have 12 classes left. So how will the days where we have exams and quizzes work?
We won't have a quiz and exam on the same day. I might not have 12, right? Maybe it's 10. I can't remember the number. You have a quiz every class except the first class period. And you don't have a quiz on exam days. So whatever that is, and I might 12 might be not right. It might be, maybe it's 10. I can't, I haven't got the, I didn't have the nursing handbook policy home thing here with me, so I didn't have it. So, but whatever it is, I'll tell you, you have a quiz every week, except the days that you have an exam. I don't give a quiz and exam on the same day. So does that answer that okay, kind of thing?
Yes,
So
thank you.
Yep, sure. I'm going to go back out to another screen here that talks about class outline. So this is just something I put out to give you some sense of what we might do each week and give you the exam times. And again, if exams, I'm flexible with exams. If, we need to give them in the evening, if that's better for some of you, I can be flexible with that. So today we're going to do intro to farm and legal aspects and med errors. General principle, next week would be general principles of drug actions, and we're going to do pain. And then the 25th would be exam number 1. And I just put 9 to 10 only just to, because exams are usually an hour, but that may run over a little bit. And then we'll do some respiratory things. Drugs that affect cardiac, hypertension, exam 2 is on the 23rd, and then we'll do endocrine, which is primarily diabetes. On the 30th, we'll do histamines and GI. November 6th will be hematology and coagulation. The 13th, inflammation. Exam 3 is the November 20th. And then we'll do renal and psychotropic and neurological diseases. And then the final exam is somewhere between the 14th and 18th, time to be announced. So I'm not sure what other people have scheduled, so we'll have to look at that. And again, I can be flexible with that. Now, in here somewhere, and I don't have it, there's ATI stuff. There are 2 practice assessments for ATI that you must complete. They are open now, and you can go in, and remember the score that you get on that is that 10% of your grade for ATI assessments. If you don't do well, there's remediation sections in that. So you must complete, and I think there's an exam, a practice exam A and a practice exam B in ATI for that. Yes.
So do we not do a proctored ATI exam?
Yes, that is at the end. There's the 3rd one, which is the proctored.
So exam number 3 is the proctored exam.
No, exam number 3 for pharmacology is a regular pharm exam, and then there's a proctored ATI exam, which is separate.
Just one, or is there 2?
There's two practice exams that are unproctored, and there's 1 proctored exam for ATI.
Do you know when the proctored exam is for both sections then?
The proctored exam will probably be somewhere, the proctored exam says you must complete 90% of the content. So I am guessing probably either on the 4th or the 11th, we would do the proctored ATI exam. I haven't scheduled it yet because I'm kind of waiting from ATI because there's a separate way to do that. So, but the 2 unproctored practice assessments you can do anytime. They recommend that you wait, like about after 4 or 5 weeks to do A, and then they recommend that you wait toward closer, like on maybe like November 6th to do the 2nd one. But those are for you, they're open and you can do them anytime. And then they will give you remediation within ATI for that. The other thing in ATI is there is a pharmacology part that has some videos related to the topics. And I think for this week, I asked that you look at orientation to pharmacology. And there's also 10 practice questions afterwards that you could do to help you with their NCLEX type questions. So that's your ATI part of this.
Are you going to be assigning ATI stuff every week?
Yes, it's on Blackboard. Today's was on Blackboard. Assignments was under announcements on Blackboard.
Okay.
And I'll do them. And again, they're yours to look at and review. And the reason I didn't get too excited for this week to have it done for today, I only posted it Wednesday for one thing. And secondly, it's orientation and drug action. So you really have 2 weeks for the first ATI program to look at. That makes sense? Questions?
Yeah, I'm looking on Blackboard right now and I don't see anything on announcements for ATI. Am I just not looking in the right spot?
Oh, there should, well,
It's the first announcement.
maybe.
It's in the middle of it.
It's a long announcement. It's in a long announcement.
It's the class on September 4th announcement.
Yeah, all it says is you may want to review. Is there like actual assignments or is it just, hey,
Yeah,
check
those
it out
are-
if you want to?
for this week, yeah, but ATI, I will post the assignments for you. Yeah, that mean when that say you may want to review, you could, I didn't know if you would have time because I wasn't sure how many people will actually get it by today. But moving forward, that will be part of your ATI kind of thing. Let me go out. Is everybody okay with this schedule kind of thing as it looks at the moment? Now, again, I being flexible with this so that you can kind of, you know, we may have to change some things as we go along based on what you're doing in 231A and B. So, and again, I'm willing to do that.
Dr. Hess, I was gonna ask,
Yeah,
so
sure.
I really like this class outline because I print it out and that's how I keep up with it. So I just didn't know like for like ATI, like if you're actually wanting that as an assignment or like the like for example the practice ones and the proctored.
Yeah.
If whenever you know that, could you add it to this
Oh,
class
sure,
outline?
sure, I can. Yeah, the ATI thing, we just sort of got it open and working and fixed so that you can access it.
Yeah, it
So
was really
that-
helpful. I did complete that one.
Yeah.
I just didn't know if we could like put it all in one area. That
Yes, I will. Yeah, I will. That was, I can say, that was yes, I will. What I'll do is I'll revamp this class outline and I will add ATI to the bottom of, or under reading assignments, I'll just put ATI and then so you know what to look at ATI, if that would be helpful. And then I'll repost it. Okay, if that's helpful. Yeah, I want to do whatever works for you guys. What's the most practical thing to do? So let me go out to the ATI policy. And again, this is, I think you probably have this someplace. I wasn't sure where it is, maybe or not. So complete practice assessment A, a minimum of 1 hour of focused review and initial attempt. And then for 14-week course, it's complete practice assessment B. And those are under the pharmacology part. And so you can go in and it tells you minimum 1 hour focused review and initial attempt. And then you get points based on how, this is for the proctored assessment, which will be at the end of the class, and based on what you get for points is how, you know, 100%, 8 to 10 points, 80%, 6 to 10 points, 60, and so forth. So that's how that 10% grade is calculated, is how you do on the proctored assessment. But you also must complete practice assessment A and practice assessment B. Practice assessments will be open at the beginning of the course, and there's an 8-hour lockout between attempts. The grade of the focused review post-assessment will be the ticket into your ATI proctored assessment. So you must have both of these completed, the A and B, before you can take the proctored assessment for ATI. Therefore, the ATI practice assessments and review, focused review are to be completed prior to sitting for the scheduled ATI proctored assessment. For the proctored and practice, that's too many words close together. For the practice assessments, rationales will be turned off. You have a minimum of 1 hour of focused review required for remediation. For 14-week courses, which this one is 212, you require both practice assessments, A and B, with subsequent remediation and a focused review post-assessment. And for the 7-week courses, they only do B. The proctored will be given during the scheduled lecture time, 1 hour in length. You must bring your own laptop. Well, you already got that. And after 90% of the lecture. So,
Dr. Hess, I have a question.
Sure.
For the practice assessments, if you get like 100% on the practice assessments, do you still do the remediation? Like, is there
No.
a threshold for that?
No, no. You get 100, you're good. That'd be great. And I'm hoping you all do, because then, geez, just think, you'll be like pharmacology experts.
What's the cutoff for the scores for the practice assessment? That means you have competency not to do the remediation.
Oh, I have not done them because I can't, because I'm not a student. So I'm not sure about that. They tell you it's already preset within ATI. So when you do them, they'll tell you.
Okay.
Okay.
Thank you.
So, yep. And then pharmacology, this is like, the course evaluation, quizzes, 20 exams, final exam, the ones we just did, and the integrated assessment. Integrated assessment is ATI. So required minimum 1 hour, complete the focused review, and print the focused review grade report for admission to the proctored assessment. So that's how that works. So
There's
you will
actually
need,
a way to email that to you.
yes, I was going to say yeah. So what you want to do for when you finish those, however you want to do it, and when you get the post review assessment grade, just email it to me, and I will keep track of those so that you are ticketed, if you will, to take the proctored assessment at the end of the course.
Can we take them as many times as we want?
I think so, but I think that there is like I say, there's an 8-hour lockout time between attempts. The whole idea of this is for you to do them. If you don't do well, you do the remediation and you keep doing till you get good at it. So that's the whole idea, and it's a learning thing. So I don't think there's a limit on how many times you can do it.
Is there a reason why the rationales are turned off?
Yep, Katie said it's because you can keep taking it over and over. So
Okay,
if they
that's,
give us the
yeah.
rationales, then we'll just go back the second time and get 100.
Okay. Yeah, I knew that we talked about this, but it was quite a while ago, and I thought that, but yeah, I think they turn them off because they want you to go back and review and figure out why you made the mistake. And if you have the rationales, then you'll just, like you say, memorize them or whatever, and then you don't learn it. And the whole idea of these practice assessments are to give you an opportunity to really learn the material and diddle around with it and play until you get good at it.
Okay.
So it's sort of like a critical element. You practice and you practice till you got it perfect, kind of thing.
I have a question about the ATI.
Yeah.
So how, in your announcement, the ATI practice exams are open. You want to review the orientation of farm.
Mhm.
Is that like under, if we go to my ATI, is it under the Learn tab or?
Oh, yeah. Well, you go to my ATI, and I think there's a pharmacology section in the student view.
Pharmacology made easy, but there's
Yep.
2 of them.
Yeah, take the 4.0 is the one you want.
Okay,
That's the most recent. Yeah, take the 4.0. And then in that are all the videos that I assign. And then I think the practice assessments are, I think there's a separate tab for those. I'm trying to remember because I went through and looked at them, but I can't remember. I'll have to go back out and see. Did anybody find them or have you?
Yeah, it's in the improve tab, but when I click on, so I'm on pharmacology made easy in the
4.0, yeah.
So intro to farm, begin lesson. Oh, okay, it's working. Just a second ago, it said like instructor turned off access to this.
Oh no, I went in. Yeah, so hopefully it's back. Hopefully it's all on.
Yep.
Let me know if you can't find it or can't do it. I'll work and figure it out what it is.
I just found it too. So if anyone wants to hit me up after it.
Yep. Yeah, I think it's so just let me know if you can't find it or having trouble finding it or whatever, and I'll figure out how to send you screenshots or something, how to do it. So,
Right,
so any questions? Yeah.
Those the practice exams, like the A and B, is that on the same site somewhere?
Yes, it should be. It's under my ATI, and I think there's a separate tab. I'm trying to remember because I went back. Separate tab for assessments,
If
And
you
I think,
filter at the top where it says content area, you can click pharmacology and it will have it right there.
it's right there, okay. Because I have the faculty view of this, and when I go into student view, because I'm not a student, it won't let me do stuff because I'm not part of your cohort. So I have to kind of rely on students to kind of help me with that. So again, if you can't find it, let me know and I'll figure it out, help you and send stuff. Okay, so I will go back and I'll add ATI to the class outline thing, you know, so by week. So, and give you suggested dates for the practice the assessments when they recommend that you do them. And I'll put a date in there for the proctored assessment, so you have all of that. Any questions related to this part at this point, or everybody okay with what we're doing? Okay, one of the things I wondered, if you are interested in, and I don't know, because we talked about that, by putting all of those narrated PowerPoints out there each week for you, and you know, going through them and looking at them, and also with the ATI, which is off different class activities, if that some weeks you would like to have pharmacology from 10 to 12 to account for those hours that you have spent looking at narrated PowerPoints. That would cut so that 10 o'clock we would have our quiz, and then I would spend, like 10:30 to 12, just going over the PowerPoints, answering any questions, looking at any comments, or, doing things like that. I didn't know if that would work for you, if that was okay, or I was just trying to think how we could kind of do some of that. Comments?
Personally, I feel like if we can keep it as close to however it would be instructed in person,
I
would prefer that. I don't know.
You would prefer that? Okay. I have no problem. I'm just trying to think, like if that, like I don't mind going through, doing just like I would do in class and talk about stuff and do that. That's fine for me. So.
That's what I was thinking.
It's easier.
You want to do? Okay, that's fine.
Yeah.
Sure. That works. I can go through and do just like, do the lecture part and show you the things just like I would do in class. If you would prefer to do it that way.
Yeah, I want us to kind of talk about the material as much as we can.
Okay, sure. Not a problem. I just thought I would offer that if that would work for you. So, okay. So I'll stop here for a second. The other thing too is because my plan is to go right straight through this, and we will stop at 11:45 to account for the breaks that I didn't give you to make the 3 hours. Unless you'd like to go to noon and just keep talking, I don't, kind of thing. But I was thinking about, that if you just want to take your breaks, we'd stop at 11:45 to account for that for the 3 hours. But we can be flexible with that. So, any questions related to course syllabus, course outline, ATI at this point? I know there might be more out there as we do stuff.
I do.
But yeah.
I have a question.
Sure.
So before we do the A and B, it wants us to review all the stuff that is on there first.
Yes. Yep. Okay. Yeah. And I'll put all those out and send you the revised copy so you can kind of see what the orientation and the next couple things that we'll do. The orientation to pharmacology, that video is actually week 1 and week 2. Because that talks about drug action and what all that is, and that's what we're going to cover next week. So that's how we'll do them. And I'll put those out there for you so you can see them.
Thank you.
And also, hopefully, what have covered ourselves in class and content and everything. So hopefully, because I was actually surprised, 4.0 just kind of came out. I was actually surprised at how closely their pharmacology stuff and what I do matches up. I went, oh, I say that, you know, kind of stuff. So hopefully it will be helpful for you to do that. Okay. So any other questions? If not, I'll go to the PowerPoint and kind of, I was going to run through the history a little bit. I don't know if we'll get through the whole thing. Sometimes I don't finish the class all the way because it, you know, and so we'll just kind of keep going and going and going till we get it all done.
Quick question. Is the history going to be on the quiz?
No. Don't, no, because, you know, who cares? You know, patient's not going to ask you. In 1970, what did the Control Act do for, you know, they could care less. You know, what I did, I only did this, I did the history part only as kind of a fun thing. And also because some of the history is so local for us, for pharmacology, I thought it was kind of fun just to go through it and just kind of talk about it a little bit in a very general. And no, there's no exam questions on history, and there is no quiz questions on history. Yeah, I mean, like, who? No. Yeah. No.
I actually thought they were very interesting.
Yeah,
Listening to the PowerPoints, because
Yeah.
a lot of it I knew about it, and then other
Yeah.
stuff I'm just like, wow, I'm like, that's pretty cool. So it was exciting.
Yeah, so I'm going to go through that then, and I'll kind of just, again, just talk, because I didn't do that on the, you know, the narration part. So I'll just kind of go through, because there is kind of some fun things there to look at and talk about. So, and again, this will not be tested. None of this material I do right now isn't testable, so to speak. So I'll go out to the PowerPoint.
You said not testable, but is it quizzable?
No. Okay. Nope. No quiz, no testable. Testable and quizzable. Are those words? I wonder.
They are now.
Okay, great.
It came from a doctor.
Okay. Oh, good. Now I got to figure out, oh, hold on here a second. Oh, I got to go back out to the share screen. It doesn't, sometimes does not work. Hold on. I gotta go out. Apparently the that didn't load the whole thing on the thing. So hold on. Can you see this pharmacology stuff or not?
I see.
It says Jefferson Community College. I'm trying to get it to be a slide. And I can't get it to.
You have birds, Dr. Hess?
You
have birds?
There, got it. Whoa! Do you see it now?
No.
No. It says it says I'm sharing. New share.
You're sharing the screen, but what it says on mine, I'm just seeing folders.
And we're hearing tire squeals.
Yes. Now do you see it?
Oh, yes. Now we see the PowerPoint.
Okay, great. Okay. Heather did these for me. And you know what? She added all these weird sounds to some of them, so pay no attention. So from a historical trends, and again, this is not testable or quizzable. So, you know, we talk about primitive medicine. Some days I think it's the same. I don't know. I just know kind of stuff. But cavemen and women, I don't, you know, kind of thing. And so they were attacked by Goliath, you know, big woolly mammoths kinds of things. So they had to do some first aid kinds of stuff. So basically what they used was cool water and they would take a leaf and make a dirt kind of thing out of it and mud and put that on. So it's like a poultice, and put it on a wound. And that's all they had, kind of, so, you know, for a soothing application for that. So it was very, you know, magical and ritual practices for that. Then about Babylon, this was 2600 BC. This was called the cradle of civilization. And they had medical texts on clay tablets. So you can see the guy, I'll kind of point to it there. You can see the guy, the clay tablet, and that's what they did. And they did a lot of praying, and they believed this was the first time that they started talking about mind, body, and spirit, and how these were all connected together. So that was what that one was. And then about 3,000 years ago, we got into the Chinese emperors based on yin and yang. The yang was considered to be a positive, active, masculine, signified by sky, light, you know, warmth, and all those kinds of things. The yin was negative, passive, feminine, signified by moon, earth, and darkness and cold. So I'm not sure they had that right, but anyway, that's what they, you know, that's what they based that on. So they sought to cure symptoms through acupuncture. So that's where acupuncture came from. And they used herbs. And at that point, they had 365 herbs that they listed: opium, rhubarb, and kaolin. Now, opium, you know, is used now for pain. Rhubarb was used as to create diarrhea, and kaolin was used as like kaopectate to prevent diarrhea. So they had, everything was herbal based because they didn't have any medicines. So here you can see the guy, the guy bring in some herbs, and then they would mash it all up, and that's what they used for that. And you can see there's, he had Ma Young. That's what that is. And the other name for that is ephedra, which we use for, now we call for epinephrine. So it was like a stimulant. The Egyptian medicine, 2900 BC, they had a thing called the Papyrus Ebers. This was sort of like the first drug book. It was a collection of 200 prescriptions, and had a pharmacist. Here's the pharmacist directing people how to make stuff in the compounding activities. And the scribe, you can see the scribe here, he take notes. He was taking notes. So as they were compounding things and making things, so they wouldn't lose the whole ideas, he would take notes for that. Then we got into the Hellenic School of Nursing in the ancient Greek civilization, 1000 BC rather. And Apocalypse, the Greek god of healing. And these were, you know, to cure and prevent disease. They had these magnificent temples on the Mediterranean Sea, and they would come and people would, to look at that. And if you can see, this is a family, and the whole family participated. So the wife is Epine, and her job was to soothe pain. The daughter's name was Hygeia, and she was the goddess of health and the prevention of disease. And the other daughter is Panacea, which is represented treatment. So the whole family kind of participated in having, you know, coming into the Greek god of healing to the temples. Then we got into the medical schools. Hippocrates, father of medicine. He believed in the four humors: black bile, yellow bile, blood, and phlegm. He's the father of medicine, and he had a very primitive knowledge of anatomy and physiology. The black bile indicated earth. The yellow bile was fire. The blood was air, and the phlegm was water. So those were the four humors that he tried to treat people with. So, and those four humors were associated with diseases. And then you got into Theophrastus, not sure, yeah, father of botany anyway. So again, he was using a lot of, he has belladonna in his hand. Belladonna is a medication we use today teaching students, and they used slabs with ivory coated with wax. So that's how they wrote, kinds of things. And then we got into a kind of an interesting thing. In the 2nd century AD, there was this guy named Galen, and he was called the Prince of Physicians. And he thought that the brain was animal spirits, that the liver was the natural spirits, and the heart was the vital spirits, hence the term vital signs. That's where that came from. Now, it's very interesting. He served as the physician to the gladiators, which allowed him to study anatomy. And his theories stood for over 1,500 years because remember, yeah, I'm sure you're gonna remember, that dissection of the body was forbidden at that point in time. So any kinds of things you wanted to look at, this was a great time because as the people were being chewed up by, the gladiators, you could see different parts of the body. So, but the church didn't allow any kind of dissection of the body at this point. So this is his first drawing of how this kind of fit together based on what he could see. So here's his brain, and he figured out an aorta. He kind of named all this stuff, and the liver and the natural spirits. The lung, he figured out that there was some air that came somehow in the heart, and he had a vena cava. It's not exactly anatomically correct, but it was better than anybody had at that point. So people really were like, oh my God, look at this. There's what the human anatomy looks like, because nobody had seen it. These are priests, Damien and Cosmos, and they are also physicians, and they were twin brothers. Damien was the apothecary, and Cosmos was the physician. So together they worked to try to help people. Then we got into the 5th century AD. We got into Black Ages, Black Plague epidemics. Doctors were powerless. People were dying all over the place. So what happens, we got back into superstitious practices with that. It was the fall of the Roman Empire. I'm sure you remember that from high school, from ancient history. If you took all that stuff, but anyway. And then we got into some 6th century, the 15th century was the Middle Ages. And this is where the Western knowledge of pharmacy and medicine were preserved by the monasteries. They grew herbs and they ministered to the sick. And it was the foundation of universities, hospitals. It started by the church. So that's where all of that came from. And then we got, medicine progressed very slowly, a lot of epidemics. This is Perlesticles, professor of physicians and surgery. And he advanced the idea that diseases were actual entities that could be combated with science activities. Up to that point, diseases were thought to be caused by acts of God, so that you wanted, to do that. The father of pharmacy, Frederick II, the Emperor of Germany, was considered to be that. And he was the one that separated the duties of the pharmacists and the physicians. Up to that point, they were one and the same. So he said, nah, you got to do all that. So I put this because I thought this was kind of interesting. The first apothecary shop. So we talk about apothecary being the first pharmacy, if you will. Does anybody know where that is? Recognize any of that? I mean, it's not like Kinney's with stuff. So this is in, this actually is in Baghdad. So in Iraq. So this was the first, obviously with a camel and stuff. So that was the first apothecary shop. So so did that. Then we got into the Renaissance period, and this is where Leonardo da Vinci, he was fascinated with the human body. And again, what he did, remember the church said, no, you can't dissect anything. So what he would do is he dissected humans. He would go to the graveyards and dissect humans. you know, and drew detailed pictures of their organs and stuff. And in your packet, you have this kind of funny body looking thing. It's one of the very first pictures. And that was one of Leonardo da Vinci's first drawings of the human body. So we won't. Then we get into, again, this is where we were beginning to discover a lot of stuff. Discovered Miguel, pulmonary circulation, and Adria Versailles, father of modern anatomy. And Cervantes was burned at the stake in 1553 by the Catholic Church for infecting his readers with unhappy and wretched poisoning. So even though he discovered pulmonary circulation, most of the people said, you know, how did you do that? Well, you did that by dissecting people, and the church said no, so they burned him at the stake. Now, Versailles, father of modern anatomy, he was the first one to put out an actual printed version of an anatomy book so that people could actually see, and this is one of his drawings that showed what the body anatomy looked like. William Harvey discovered circulation, and so he did that. And again, you don't need to memorize these. Louis Van Hook invented the microscope, and then Malapeti founded pulmonary arteries and veins. The first London pharmacopoeia was introduced with opium, coca, and ipecac. And that was by 1617, King James I. And so he was the sort of took care of the apothecaries in London. And so they had it first. So that was the very first published book of medications. 18th century, Morgani, father of modern pathology. And then in 1785, William Witherington introduced digitalis. And we'll talk more about that when we get into cardiac. We'll look at, you know, how he found out. It was kind of cool. Jenner introduced smallpox vaccine. Now, up to that point, smallpox was bad. There was no treatment. If you got it, that was too bad for you. He discovered or witnessed that milkmaids, back in those days when you milked cows, they had milkmaids that went from farm to farm and milked the cows, that milkmaids infected with cowpox were immune to smallpox. So he figured all that out. So smallpox claimed 60 million lives in the 18th century. So once he did that, he developed a vaccine, and this is Jenner giving the vaccine to his son. And that was the very first smallpox vaccine, and we still use the same vaccine today that he developed. Also, this was a time when purges and enemas and bleedings were popular. We're still kind of in the golden age of quackery. So people came to your house every day and gave you an enema. So to clean out, that was considered to get rid of bad spirits. That was what, you know, so I don't know if that's exactly a job I would like, but they would purge the system. It's like having preparing for a colonoscopy every day, I guess. But they got rid of all of that stuff. And bleedings were popular, bloodletting. Again, you know, wasn't a lot of stuff out there to do that, but that's, so they did all of that. Bloodletting was kind of an interesting thing. Hippocrates believed that it restored the body's harmony. And it was practiced by surgeons and barbers in the Middle Ages. And that's why there's a red and white pole outside a barber shop that told you that they not only would cut your hair, but they would get rid of your blood if you needed to. So that's where that came from. And George Washington died after 9 pints of blood were removed for the treatment of a sore throat. I happened to go to his house in Virginia, you know, on a trip, one of those historical kinds of things. And one of the things we learned from that was he had a sore throat. he was out tending his cows and sheep and all, and came and said, oh, I got a sore throat. So they called for the physician to come from Arlington, Virginia on horseback, which he did, his physician. And the only treatment said, oh, it's because you got bad blood in you is why your throat is so sore. So what he did was he started taking out a pint at a time. And the sore throat got worse and worse, so they just kept taking it out and taking it out. So eventually what happened was that he just died of exsanguination. They took so much blood of him, he just died. Now, most likely, if they just left it alone, he probably would have been fine, but unfortunately, he died from bloodletting. And here's a picture of the pole, the red and white pole. So you could do barbers and you could be a surgeon at the same time back in those days. In 1815, we had the introduction of morphine. Then the stethoscope was invented in 1816. Up to that point, physicians could not listen to chests. They would roll up a magazine and they would hold it up there or a newspaper and listen to it. And then the pharmacopoeia was published. And or they would put their ear directly on the chest, and physicians weren't allowed to do that with women. So they had to sort of guess what was going on the lungs. So the stethoscope helped that a lot. In 1831, chloroform was introduced. Now, I don't know if you know, but chloroform was made in Sackett's Harbor, New York, by Samuel Guthrie. You probably have heard the name Guthrie. Guthrie Clinic, Guthrie Building, Guthrie everybody. That's Samuel Guthrie, lived in Sackett's Harbor. And in your packet, I got way too many papers laying out here. I'm going to have to get a big desk like the. There's a little description of Sam Guthrie. And if you can see it, but anyway, he did a couple things. First of all, he moved to Sackett's Harbor in 1817 because he was a physician at Madison Barracks, which was the Army post prior to Fort Drum in Sackett's Harbor. And he lived on the old mill, which is right on the mill. It's on the, as you come in Route 3 to Sackett's Harbor, that house still stands. And in the basement, they have left all the burned areas because chloroform was really explosive and he used to kind of burn stuff all the time there. So the other thing that he did was he would go get graves, people out of the graves, and do autopsies and do all sorts of things. And he sold them to medical schools. He would sell them to medical schools. So the other thing that he did was he was considered, and he discovered it in the summer of 1831, chloroform he called sweet whiskey. And they used that a lot for that. And he also was long experiments with gunpowder. And he was the one that came with the idea with, let's see, I don't know what you call it, precision gunpowder. And he primed it and he had a flintlock kind of thing so you could actually fire the stuff. So he kind of invented that as well. So he was kind of a character, I guess, and drank a lot, but he was the physician in Madison Barracks. And so before chloroform, there was no anesthetic agent. So what they would do for surgery, and again, remember, there's War of 1812 in Sackett's Harbor. And so they had a hospital there, and a lot of the soldiers were brought to Madison Barracks to the military hospital. And Guthrie was their physician. So what they did with that was he would give them whiskey until they got drunk and passed out, and then they would do surgery. And for minor surgery, I don't know, minor, they would give them a bullet to bite on. And that's where you got the term bite the bullet. It came from military surgical procedures back in those days. So that's for us, that's kind of a local kind of thing. And all of you people that live on Fort Drum and have, Guthrie stuff all over the place, that's where it came from. It came from Samuel Guthrie in Sackett's Harbor thing. Then nitrous oxide was introduced in 1844, which was a little bit better. That was called laughing gas, made people very happy thing. Then they went to ether, and this is Massachusetts General Hospital. And Boston. And it's kind of interesting. You'll notice that they have no gloves. There's no kinds of infection control things. This is the gallery of people. You can come in and watch stuff, watch them do surgery. And they would use ether. And with 1886, the first appendectomy was done there using ether for surgery. Syphilis was a big concern. One night with Venus, 3 years with Mercury. Venus was your contact, and then it was treated with Mercury. So the problem with that is that Mercury is now is considered to be a very poisonous metal thing. So they died from mercury poisoning, not from syphilis. So that didn't go well. And then Florence Nightingale, and we know a lot about Florence, 1820 to 1910. She was sort of I consider her sort of the invention of nursing, if you will. She's the one that figured out all this kinds of stuff. And again, in your packet, I had something that I thought was kind of interesting from Florence. It talked about what you should do for a nurse to get ready for your day. I can find it.
Dr. Hess, you are talking about this packet, right?
Yep, yeah, when I say the packet, that's the one I'm looking. Yep, I got one just like it.
Well, no, I couldn't find your Samuel Guthrie one, and I don't know what page you're going to for.
It's after the PowerPoint. If you go to the PowerPoint and you go to the, if you want to do that, we can do that right now. Have your packet. If you open it, go to the end of the very last PowerPoint. And then you'll see a picture. That's the one that I referred to that Da Vinci did. And then the next page over is Samuel Guthrie excerpts from Here, There, and Everywhere. Did you find that one okay?
Yeah, I was looking for a picture.
And then, okay. And then after that is the next one here. And this is the Florence Nightingale's Duties of a Hospital Floor Nurse in 1887. And this came from Florence's book on Notes of Nursing, I think it's called. And what she says, and I think this is kind of funny. I mean, well, it wasn't funny then, but in addition to caring for your 60 patients, and she was the only person, so she had everybody. Each nurse will follow these regulations. And you think we're bad in nursing school. Wait till you read this stuff. Daily sweep and mop the floors of your ward. Dust the patient's furniture and windowsill. Maintain an even temperature on your ward by bringing in a scuttle of coal for the day's business. So you had to bring your own coal to work. Light is important to observe the patient's condition. Therefore, each day fill kerosene lamps, clean the chimneys, trim the wicks, and wash the windows once a week. Nurses' notes are important in aiding the physician's work. Make your pens carefully. You may whittle nibs to your individual taste. Each nurse on day duty will report at 7 a.m. and will leave at 8 p.m., 12-hour shifts, except on the Sabbath, which you will be off from noon to 12 to 2 to attend church. Graduate nurses in good standing with the director of nursing will be given an evening off each week to regularly attend church. Each nurse should lay aside from each payday a good sum of her earnings for her benefits during her declining years, so that she will not become a burden. For example, if you earn $20 a month, you should set aside $10. Now remember, this is before Social Security. Any nurse who smokes, uses liquor in any form, gets her hair done at a beauty shop, or frequents dance halls will have given the director of nurses good reason to suspect her worth, intentions, and integrity. The nurse who performs her labor, serves her patients and doctors faithfully and without fault for a period of 5 years will be given an increase by the hospital administration of 5 cents a day, providing there are no outstanding hospital debts. So that was the duties of the nurse. I hope we've changed things enough, but just kind of interesting to see. The other thing Florence Nightingale did, which I think is kind of interesting, is I went to a conference a couple of years ago called Florence Nightingale, What She Knew and Where We Have Gone Wrong. And it was a very, very fascinating conference because they had done a lot of research on Florence. They talked about infection control. Florence figured out that hand washing and all those kinds of things, you know, the light and cleanliness were of utmost importance, that's what prevented infection. And until that time, nobody paid any attention to that stuff. So, you know, we really owe her a lot. She was really the infection control person that got us to where we are. Yes. In 1922, Banting and Best discovered insulin. And again, that was a major, major thing. It was done at McGill University in Canada, worked with dogs and figured out how to do that. Again, if you're back at your packet, the very next part, there's a thing that says Dr. Fred Austin, 1877, description of diabetes. If you see that, I don't know. Now, Dr. Fred Austin was my great-great-grandfather, and he was a physician and a pharmacist in Sandy Creek, New York, where Julie lives. And she knew the family. Her mother and father knew the Austin family in Sandy Creek, Lacona area. So this was my great-great-grandfather's description of diabetes. He thought it was a disease of the kidneys. And remember, this was written in 1877, long before Banting and Best were, you know, got into their insulin. So the disease is characterized by large quantities of urine and often involuntary discharge of it. So in other words, there was so much urine output, people couldn't manage it. So they just, remember the 3 Ps of diabetes, polyuria, polydysnia, polyphagia. So it's accompanied with great debility, fever, ferocious appetite, and emaciation. So, you know, there's, you know, and that sort of talks about, you know, increased hunger, increased thirst, and urine output. So it's caused, he says, that was caused from use of liquor, debility, and poor diet, and depressing, excuse me, depressing passions. Makes its approach insidiously, accompanied by lassitude, weakness, disposition of sweating, and headache. Striking symptom is quantity of urine. And then he goes on to talk, there's so much urine with frequent desire to pass it. The patient is compelled to rise 3 to 4 times a night for this purpose. Great appetite, bad digestion, you know, flatulent, all these, you know, kinds of things. So he goes on to talk about that. The breath has an acid odor, which, you know, talk about diabetes, ketoacidosis. The tongue, the gums are swelled, tender, red, ulcerated, bad breath, you know, all those kinds of things. It's variable, running from 5 to 6 months to several years. So there was no cure, and you died from it. So the treatment. This was, you know, and he talked about all the kinds of things, bathing in tepid water, and bitters may be taken, a medic occasionally, you know, all that kind of stuff. And then on the back, there's a regime of how you do that. So the cured diet has a great significance of the cure of this disease. So diet, which consisted of boiled beef steak, well cooled and thoroughly masticated without bread or vegetables of any kind, was taken 3 times a day in small quantities with very little drink. And the thing is, you know, there was no cure for diabetes, but they tried all sorts of things. But that was his whole description of diabetes and what he thought it was and how he treated patients in Sandy Creek in 1887 with it. So Banting and Best introduced insulin. And this is the first insulin production. It was done by Eli Lilly and Company. And what they did was they took pancreas, I don't know if that's pancreas from pigs and cows sometimes, and they would grind them all up in their big grinder, and it produced a pulp kind of mixture, and they would draw that up in a syringe and give it. And what happened with that, well, as wonderful as that was, what happened with that is the first person they gave it to was a young boy who was 14 years old in Canada. I think his last name was Thompson or something. Anyway, what happened with that was that he got abscesses from the insulin and, you know, the pulp, and, you know, it wasn't purified or anything. But what it did do was it saved his life. And so then, of course, it produced, and, you know, now we have all sorts of insulin, and we don't get it anymore from animal sources. It's a DNA recombinant process, which gives you a lot more control and flexibility. So, so that was the first insulin production, pictures of it. Then we got penicillin, sulfonamides, cortisone, and then polio vaccine. Again, polio was a big thing in 55, and then they updated it with oral vaccine in 61. You know, virus, people got it. It, you know, sort of reminds me of where we are now. It was a respiratory illness and caused a lot of paralysis. So what would happen if you got polio is you would be put in an iron lung, and your head would stick out here. And this was a mechanical device that breathed for you. It increased pressure on the inside, which forced the air out, and then it created a vacuum, and which sucked the air back in. So that's how you breathed. Some people got better with it. A lot of kids. It tended to affect children very badly, and so, you know, that's what it was. This was a polio ward in the 1950s, and you can see the nurses tending to the children. They had little things on the side where you can open up the latches and care for people. You'll notice they were different sizes depending on how old the children were. So it was a horrible, horrible thing. And like I say, many people died from it, and a lot of people that had it have a lot of physical disability because of the paralysis. Left them very weak. So that was a big thing. Then the next thing we had was AIDS. So we didn't get any antivirals till 1970, but 1987 they finally come up with AZT for AIDS. 1996 they introduced the protease inhibitors, so now that is under control, not cured but under control. And now we're into targeted therapies to stimulate the body's own immune system with anything that ends in MAB. And there's the new drugs available for lung cancer and metastatic breast cancer, which have proven fairly effective. And now we're looking at addiction. And during this COVID process, that has become even more of an issue. And the other thing now we're looking at is antibiotic overuse. Now we're into a situation where we have so many kinds of bacteria that have become resistant to antibiotics. So that's sort of a historic. Yes, ma'am. Tammy, I see you. Yeah.
Okay, so why addiction has been an issue, but why are we relating it to the COVID thing going on right now?
Because more people are home and they're dealing with more stress and anxiety, being isolated. Increase. Yes, increase. Yes. I should put. Yeah. Oh, I see what you're saying. Yeah. Because it's been around, and when we do drug laws, we'll see. You know, you'll look at that and you go, oh, yeah. It's an increase in how that.
Now that makes sense.
Yeah. Okay. But thank you for that clarification. Yeah. So the next thing I kind of want to. And again, you kind of wanted me to go through, and we'll just look at is names of drugs. And again, I put these out there on your, and narrated, but we can talk a little bit about them. Names of drugs come in three. They're chemical, generic, or non-proprietary, or trade or proprietary. The chemical name is the actual drug composition. And again, if you go to your packet, so I would put this up on, you will see a table 4.2 that talks about the 3 names of drugs, and it has a drug picture on it. And this one is acetaminophen. And you can actually see, you know, that has carbon and nitrogen and oxygen and hydrogen and all these kinds of things. And that is the chemical name, N-acetyl-para-aminophenol. We don't use those. You know, if you know, research people do all that kind of stuff. And if you're looking at drug composition, you know, chemicals, great, but we just simply don't. We're more interested in the generic or non-proprietary name. Each drug only has one generic name. And that's an important concept. And the generic name for N-acetyl-para-aminophenol is acetaminophen. So that's why we've gone to generic names, is because there's only one per drug. Trade or proprietary names, there can be hundreds of them. And if you look at that sheet for Tylenol, you can see there's stuff like Genapap, Minapap, Neopap, St. Joseph's, Tempra, Tylenol. And we use Tylenol here as a trade name, but if you went someplace else and somebody said, oh, would you go get me a media tab? Would you have any idea what that is? Probably, you know, you may or may not. So, but if somebody said acetaminophen, you'd know right away, oh, I know what that is. I know that that's Tylenol. So, oh, I should tell you too, this is where the quiz stuff starts. Is it this name of drugs? This is where you would be tested from this point on, the names of the drugs. It starts there. I just wanted to tell you that too. I forgot that. So to do that. So those are chemical, generic, and trade and proprietary names. So chemical is the chemical structure. Generic, one name. Trade name is the company's property. They can name their drug anything they want. So, okay. Oh, that's a lovely picture before lunch, don't you think? So, where do drugs come from? They come from 4 sources, basically. Plant source. Some examples of plant source drugs. And on the narrations, I talked a little bit about these, but digitalis. Digitalis comes from a purple foxglove plant. So, you know, you grind up purple foxglove and you make dig out of it. Morphine comes from a plant, comes from opium. So there's quite a few gum sources come from there. Things that we make ostomy gum things out of come from gum tree plants. So there's all sorts of things that plant source. A lot of our herbal medications are plant source, of course. Animal source, we don't have as many as we used to, animal source meds, because animals have a particular protein that some people are allergic to. They're a little bit different genetically. So we don't use as many animal source as we used to, but there are still a couple that come from animals because we don't. One of them is epinephrine. Epinephrine still comes from animal sources. Premarin comes from pregnant horse urine. And a lot of controversy about that, which, you know, animal rights and so forth are very much into that. The other thing that comes from animal sources is heparin. Right now, heparin is the only animal source is the only thing. So mineral sources, things like iodine, Epsom salts, all of those are minerals, come out of the ground. The other thing that's a mineral is lithium. Lithium, for you guys in psych, lithium is a salt. And so comes out of the ground there. And chemical, everything that doesn't come from a plant, an animal, or a mineral is a chemical source. Sulfonamides, all those kinds of things are chemically made. Now insulin is chemically made, all of those. So those are where we get our drugs from a source point of view. Terminology. You can see that there's some terminology kinds of things here. And again, I have put them out on the narration and they're also in your packet. I think there is a terminology. I say that with great confidence that it's probably not there. Yeah, it looks like this. So this has, it says terminology. And so you will find all of the descriptions I'm going to talk about on this pharmacology. Oh man, it's reversed on there, isn't it? On the camera. If it, if you unreverse it, it's pharmacology. It's kind of thing. So, so pharmacology is the study of interaction between drugs and living systems. That's the general definition. Now there's lots and lots of areas of pharmacology, but I've chosen these 4, and these are the 4 that we will focus on for quizzes and exams. The first one is pharmacotherapeutics. Pharmacotherapeutics deals with the therapeutic effects of medications. Talks about, you know, drugs in the human body for specific applications, and that's pharmacotherapeutics. Pharmacodynamics is the experimental theories of drug action. Now, one of the things that we're going to talk a lot about next week, we're going to talk about drug action. And we're going to talk about things attaching to receptor sites and how they move through the body and how drugs are used. And that is what pharmacodynamics is. It's the process of drugs on receptor sites and how then what happens to them. So therapeutics is the therapeutic use of drugs in the body, and pharmacodynamics is where drugs attach to receptor sites and how they're used from that. Pharmacokinetics talks about the movement of drugs through the body. Kinetic meaning movement. So those are the areas of absorption, distribution, metabolism, and excretion. Okay. Absorption, distribution, metabolism, and excretion. So those are the 4 areas related to that. Pharmacogenetics talks about the genetically induced aspects of drugs.
Can you repeat that one? That last
Sure,
one?
sure, yeah. Pharmacogenetics deals with the genetically induced drug response. Genetically induced drug response.
What would be an example of that?
Those are the ones where you take a medication and it actually alters the metabolism in the fetus. Might be or the genetic part in the fetus. You know, that's where they get that category X. We no longer use those, but you can, but that's where that is, and how it may or may change the genetic alteration, particularly in a fetus. It doesn't do as much in the human body, you know, in adults, but it will change it from in children.
Thank you.
Yep, sure. No, ask away. Ask anything you want, you know, kind of thing. You know, chime right in. So
ATI really helped with all of this stuff.
Right. Yeah, that's why I said it follows very closely what I was surprised because this is the first time I've incorporated ATI into pharmacology, and I was surprised at how much of what I said is exactly what they said. I could be teaching for them. No, I don't want to do that. That's kind of, but it was good. So I was glad that, you know, if you look at that, it has a lot of the stuff on it. So these are characteristics of drugs. We talk about effectiveness. Effectiveness is the most important property that a drug can have. So, you know, if I were to say to you, what's the most important property? You're going to answer me. Effectiveness. Okay, so that's what that is. Safety. Safety. There's no such thing as a entirely safe drug. Every drug has an effect in the body and can cause serious problems. So that's one of the things. Selectivity. There's no such thing at this exact point in time of an absolutely selective drug where you would take it and it wouldn't affect any other parts of the body. All drugs can cause side effects. Now, interestingly, selectivity is an interesting part for cancer research because what happens is they're looking for a drug that is very selective on particular kinds of cancer cells. So at some point, selectivity, that definition may change because of the ability to have it directly related to cancer cells. So I put down here the ideal drug. So if you could take a couple seconds, I want to make sure we stick to the noon time frame here. Just write down 3 things that you would think an ideal drug should be. If you were going to make a drug, what would be the ideal drug? Just take a couple seconds and write down 3 things that come to your mind. Okay, what did you come up with? Just sort of, anybody out there, you know, kind of, anybody still with me?
Side effects.
Side effects, okay. It wouldn't have any, right? We'd get rid of side effects. Okay, what else?
Kill the bad cells.
Kill the bad cells, yep. Kill the
Work
bad
as
cells, keep the
intended.
good ones, yep. What else?
No
cost.
Yep, okay. Anything else? Kind of thing?
Low cost.
Low cost. Easy to administer. Predictable. These are some other kinds of things I was thinking of. So, you know, we talk about ease of administration. We don't use as many IM meds as we used to, but back, and I put this in your packet again, just, you know, because I just think it's fun to have the information. I don't know. I like pharmacology. So if you see this in here, this is the textbook of nursing. And of course, now it's reversed, but it's a textbook of nursing. This is the pharmacology chapter. It was written by Clara Weeks and distributed in 1886. And I talk about the ease of administration. There are 3, and if you look at the very first page of it, it says, there are 3 ways of introducing medicine through the skin, known respectively as endodermic, epidermic, and endoepidermic. You don't need to memorize. This is just something I wanted to share with you. So the first one, the endoepidermic, is you just put it on the skin. And, you know, that would be like what we would call topical now. You put it on there and it just absorbs. In the endermic method, now this is the one I wanted you to be. The cuticle is removed by blistering, and the medication is sprinkled over the raw surface. That's how they used to give medications, because we didn't have IMs and we didn't have IV medication at that point. So if you wanted it to get absorbed quicker, what you do is you take their fingernails off and put it on there. So I thought, well, isn't that great? Now, that method is now, you know, by hypodermic. They were just introducing hypodermic injections at that point. So abscesses are due in either to carelessness, injection, and using a syringe not thoroughly clean. They were glass syringes and needles, so you had to clean them. So I just thought that was kind of interesting to look at. You talk about ease of administration now, and I suspect at some point that's going to get even better. We don't give very many IMs anymore even. So, so you look through that and you think, oh, I'm glad I didn't take pharmacology in 1887, kind of thing. So. Anything else related to the ideal drug anybody wants to throw out there that?
I do have
yeah.
a question.
Sure.
So regarding the safety of a drug, I don't know if I just didn't hear it, but no drug is like 100% safe, right?
That's correct. That's correct.
Okay.
That's what I want. Now, you know, it may not have a lot of terrible side effects, you know, or, you know, how we consider, but right now, no drug is considered to be 100% safe.
Okay. So no matter like how minor the side
That's right.
effects.
That's
Okay.
right. Yep. Yeah. And that's what they refer to that as, you know, like there just isn't anything as something, it will produce something. All our drugs at this point produce something. So, yep, you're absolutely right. Sources of drug, again, I'm watching, make sure I don't. Sources of drug data. Oh, geez, think come quick. You want to make sure that you're getting a good, don't ask your next door neighbor about drugs, you know, kind of thing. They don't know stuff. So if you want to, you know, you're going to ask people, ask clinicians, physicians, pharmacists are great. Clinical pharmacists can tell you everything you want to know. I oftentimes consult a clinical pharmacist if I have a question about a particular medication.
Dr.
Quality
Hess, I have a
control
question.
center. Yeah.
When I was going through the slides, for people, could you ask a patient or their family about their drugs?
Yeah, yeah, that's a good. I asked them, but I asked them in terms of what do they know about it. I don't expect them to have a great pharmacological background in their medications, but it's important to ask them of, you know, what are you on? What do you take it for? All those kinds of things. Yeah. But this is more related to a professional source kinds of things. So if I were in a clinical area and I had a question about a med, I get right on the phone and I call Marcia Call, who is a pharmacist at Samaritan. I call her and say, Marcia, what do I do with this? How does this work? Is this safe to mix with this? If I can't find the answer somewhere. So ask people and be careful who you ask. Published information, textbooks are very good. Newsletters that come from drugs and therapeutics, those kinds of things. You know, those are good. Don't pick up a brochure from somebody, say, oh, this looks good, kind of stuff. I used to I don't know if any of you back in the olden days, there was this book called Reader's Digest. I don't know if you see it in the supermarket on the shelves sometimes if you go, of course, who goes grocery shopping anymore? And they used to have this series called I Am Joe's Stomach, or I'm Joe's Brain. And it was all this kind of stuff. And it was meant for lay people, but I was amazed at how many people picked up on it, you know, kind of stuff. Don't do that. Or what you're reading, Red Book or something. So published information should come from a reliable medical source. Reference books, Physician's Desk Reference, PDR. Use that. Drug facts and comparisons. And you have a drug book, I think, that you purchase with your package. Those are good. Lenny, you know, all sorts of things. And the internet. Be very careful on the internet for what you source. Make sure it's a .gov, .edu. Don't use .coms. .coms are commercial sources, and they will tell you not very good information. So make sure you use good information for doing that. Okay. Any questions related to where we are at this point? Of any of the information? Hearing none. What I'm going to do is I'm going to stop there because it's getting close to noon, and I know you have other obligations like classes have to make sure you have lunch and that sort of thing. So what I'll do is we'll pick up with the rest of this next week, and we'll also do drug action. So your quiz next week will be based on only information that I have touched on to this point. So it will start with the names of drugs, chemical generic trade, sources of drugs, the terminology, the characteristics, and sources of drug data. Those will be what the questions will be focused on.
I do have a question, Dr. Hess.
Sure.
I'm looking at your class outline and there isn't anything in here for the 9th of October.
Okay, I might have skipped over that. Who knows? I could have done that. You know, I did. Yes, thank you. I'll look at that and see. I'm going to redo that anyway and put the ATI stuff in it. So I'll look at that. So thank you. Thank you. Yeah. I should make a note of that just in case. On 9th of October. Okay. Anything else anybody has a question about or concern about? Watch. I'll put things out on Blackboard for information under announcements. I think those are emailed to you once they go out there. Is that correct? Do you get them? No? Okay.
Yes, announcement, no.
Announcements are not emailed?
They're not emailed. I get like text messages.
Oh.
And they all come at like one time. So I get like 30 at one time. It's like a
Oh, God. Okay.
connection problem.
Oh,
Sometimes my app will update me and tell me something's uploaded when it gets uploaded. Other times, like Kristen said, I'll just get like 20 notifications all at one time.
Okay. Well, that's not very helpful, but so if you could go into Blackboard once in a while.
Dr. Hess?
Yeah.
When you create the announcement, there's a box that says to send an email.
Yep, I sent, that's what I
And it will
clicked.
send an email out.
Okay.
Okay.
Okay, thanks. I will make sure I check that. I thought I was, but because they had indicated that that stuff came automatically, but I will certainly check that box to make sure that you get the email. So it goes out for that. As particularly because this class is all remote. I want to make sure you get the information as quick as I get it out there. So I will do that. Thank you. Anything else? Any other suggestions, helpful things I can do, or anything anybody has any questions about? Or I will work on doing the drug action narrative slides, and they will be a little less cumbersome than all that history slide stuff, because that didn't, so I'll do that and put those out for you this week. So you'll have that information. You can look at it ahead of time, and then we'll be all set. And I also will put out more PowerPoints for the upcoming classes. So you can just look at the PowerPoints if you want to and kind of get an eyeball them and see what you want to look at. Anything else that I can put out that's helpful for you to look at ahead of time or do?
Stress for the upcoming quizzes would be relieved if we knew what we needed to download for those, like the proctor, what is it? Respondus and
yeah. Yeah, I don't even have that information yet. So I'm waiting for Katie to do that. So as soon as she does, I will put that out, make sure I click on the email part and send it to people so we can do that. If it doesn't happen this week, which, you know, who knows, I may do like 2 quizzes the following week, 2 separate ones based on what we did this and then following that, because I don't want to put something out and not have it work and screw it all up. So we'll do the best I can with that. I'll let you know how we make out with that. But I want it to work well before I do it. So maybe you won't have a quiz next week. Still study. At some point you will have it, but it might not be if I can't get responders to work.
And then you're going to upload today's Zoom somewhere, somehow, some way.
Yes, I'm not sure. It's on the cloud. I'm not sure how I'm not sure where or how to upload it. That's something I've got to check with. I'll have to call IT about that. It's recorded, it's being recorded, but I don't know how.
Katie knows how to do that, I think.
Pardon me?
I think Katie knows how to do that.
Yeah, I'll check with her how to do that because I've not ever recorded anything on Zoom before. So I'll ask her, but I'll get it uploaded and I'll try to give you a message as to where the darn thing is when I figure out how to do it. So this is all kind of new to me too. So we'll do the best we can with it. Okay. Anything else that anybody wants to know or do or ask at this point? Send me an email. Like I said, I get my email on my phone if I can do anything or help you with anything. So, okay. Okay, well, nice to see you all again. And again, let me know if you have any issues, any problems. I'll be in touch. And have a good afternoon. I hope class goes well this afternoon for you.
Thank you.
Okay,
Thank you.
see you all again
Bye.
soon. Bye.
Bye.